What am I really supposed to look for? It says evaluate for acute myeloid leukemia, but these just look like lymphocytes. What am I supposed to do? There's clearly chronic lymphocytic leukemia in the peripheral blood. Why do we need the marrow? When you're first starting, you don't always know what is important. Some cases are obviously abnormal. However, many others only show slight changes from normal. It's not always clear what your next step should be, and the WHO may not easily provide all these answers. So this chapter is your cheat code. On a HEMEpath rotation, the main specimens are 1. Peripheral blood smear, 2. Bone marrow biopsy, 3. Lymph node or mass. Some institutions also include the evaluation of cerebrospinal fluid or other body cavity fluids to the HEMEpath service. However, this chapter will focus on the 3 numbered specimens. From the clinical perspective, there are different questions that need answering at different times. The first question is of adequacy. For a peripheral blood smear, adequacy is proper staining and enough intact cells. If leukocytes are exploded, which may or may not be smudge cells, an albumin preparation is necessary. For a bone marrow biopsy evaluation, the complete specimen will include a peripheral blood smear, marrow aspirate or touch prep, and core biopsy plus or minus a clot section. The aspirate differential is not the end goal of evaluation, but is sometimes a tool to help answer a clinical pathologic question. For a lymph node or mass, there needs to be enough tissue to evaluate architecture and enough non-necrotic cells to perform immunohistochemistry, flow cytometry, collected prior to formalin fixation, FISH, and molecular if appropriate. If the specimen is not adequate, no specific diagnosis can be rendered. Request more tissue. Now for some common clinical questions. Peripheral blood smear. If there is leukocytosis, a basic clinical question is this acute leukemia? The primary tasks are to quantify blasts, rule out or in acute promyelocytic leukemia, and rule out or in chronic myeloid leukemia. If there is lymphocytosis, a basic clinical question is this chronic lymphocytic leukemia, or CLL? The primary tasks are to confirm cells are lymphocytes and not blasts, quantify prolymphocytes, and immunophenotype the cells. If there are rare blasts in a patient with a history of acute leukemia, a basic clinical question is this relapse? The primary tasks are to quantify blasts and identify any features of growth factor treatment. If there is pancytopenia or thrombocytopenia, a basic clinical question is this acute leukemia? The primary tasks are to quantify blasts and rule out or in acute promyelocytic leukemia. Bone marrow biopsy. In the setting of acute leukemia, a basic clinical question is, what is the initial diagnosis category? The primary tasks will be to confirm the myeloid versus lymphoid lineage and classify, if possible, often with ancillary studies. Another basic clinical question is there a treatment response? The primary task would be to quantify the blasts. In the setting of lymphoma, a basic clinical question would be, what is the stage of disease? The primary tasks would be to evaluate for the presence of lymphoma, and if CLL or SLL, evaluate for increased large cells or Richter transformation. In the setting of a monoclonal protein, a basic clinical question is this multiple myeloma or another plasma cell neoplasm? The primary tasks are quantify plasma cells and evaluate for clonality. In the setting of pancytopenia, a basic clinical question is this MDS or something else? The primary tasks are quantify blasts, quantify dysplasia, and identify any other infiltrates, infection, or metastasis. In the setting of cytosis, a basic clinical question is this MPN or something else? The primary tasks are quantify blasts and classify the neoplasm if possible. In the setting of a known MPN, a basic clinical question is the disease progressing? The primary tasks are to quantify blasts and quantify fibrosis. Lymph node or mass. In the setting of new lymphadenopathy, a basic clinical question is is this lymphoma, carcinoma, or granuloma? The primary tasks are confirm specimen adequacy, evaluate for lymphoma, and classify if possible. In the setting of a prior lymphoma diagnosis, a basic clinical question is this a recurrence? The primary task is evaluate for the prior or a new lymphoma. Again, this is not the entirety of the clinical questions that can be asked. However, this covers at least 75% of the cases that we see on a daily basis.